So it is a phase 2 study that looking for the combination of oral therapy for the acute myeloid leukemia. So as you know, it's talking about the ASTX727, which is an oral formulation of the fixed dose combination of Decitabine and the Cedazuridine. And it is recently was approved for the treatment for myelodysplastic syndrome. And as you know, hypomethylating agent with Venetoclax is the standard of care for treatment for AML, mainly the patient that is unfit for chemotherapy or intensive chemotherapy based on their age or their comorbidities. So we wanted to see an oral regimen for these patients. So we did a phase 2 study that we included mainly patients with relapsed refractory AML aged more than 18 years, or patient as a frontline more than 75-year-old patient with AML, or patient with age 18 to 74, but with comorbidities conditioning that prohibiting them from receiving intensive chemotherapy. So mainly we have two cohorts, the relapsed refractory cohort and the frontline cohort. All the patients had adequate liver and kidney function, and mainly one of the inclusion criteria was the absence of any active infections and echo performance of at least two or less, I'm sorry. So mainly we had recruited 28 patients, 15 patients in the front line and 13 patients in the refractory relapse cohort. The treatment itself is consisted of 5 days of oral Decitabine and 28 days of the Venetoclax in the first cycle, and from the second cycle and subsequent cycle, it was only 21 days. So we have 28 patients. The median age, which is an important thing, the median age was 74 years for the whole cohort. Okay, and almost 60% of the patients were at age more than 80, and around 30% of the patients were in the age between 70 to 80. So we are talking about a patient who is not in great shape with acute myeloid leukemia that we are giving him some good treatments. So regarding our in terms of efficacy, let's say the treatment, the overall response rate was almost 61, almost for the frontline patient, and about 45% for the relapsed refractory patient, with overall survival that was not reached for the frontline and was about 7 months for the refractory relapse patient. So in all, we are talking about oral regimen for acute myeloid leukemia for patients that are not unfit for the chemotherapy based on their age, based on their comorbidity. And you know, these patients are really unfit, mainly older patients, unfit. And we are giving them very well tolerated treatment with the main side effect or adverse event in our study were mainly myelosuppression related, which is mainly neutropenic fever. Okay, but at the same time, we are giving them a good treatment, and the most important thing that we had almost no GI toxicity, which is also associated with the treatment of hypomethylating agents. We are continuing. We have only now about 28 patients. We are continuing to recruit patients in this study, and hopefully we'll give for this patient as a frontline some good treatments.